Where is the risk? The question, where is the risk? It has been the subject of considerable philosophical debate, and the word risk has several definitions, some more quantitative than others. The term can mean the unwanted event, for example, myocardial infarction, the cause of an unwanted event, the probability of an unwanted event, the, the expected value of an unwanted event, the probability multiplied by a measure of the severity of the event, for example, the probability of the myocardial infarction and the associated probability of death, and the decision made in the context of known probabilities. An additional commonly used this term uncertainty. This may refer to unpredictability, for example, throwing a dice, or a lack of knowledge. When used in the clinical context, it often means combination of both.
Cardiovascular disease involves abnormalities of the heart and blood vessels. Coronary heart disease is the most common condition and is the leading cause of death in the United States for both men and women. The lifetime risk for developing significant cardiovascular disease is greater than the likelihood of developing cancer. Your heart is a muscular pump that requires heart arteries to supply oxygen-rich blood to keep it going. Coronary heart disease occurs when these blood vessels become narrowed due to a buildup of plaque. The plaque is made up of cholesterol and other substances. This process is called atherosclerosis. Atherosclerosis occurs over a lifetime and is influenced by risk factors. Some risk factors can't be changed. However, others can be altered through healthy lifestyle choices and medications if needed. Symptoms of coronary heart disease occur when the heart muscle does not get enough oxygen. Some describe this as chest pressure or chest pain that starts over the left chest and can radiate or travel to the left arm, left jaw, back, or sometimes to the right chest. Some patients do not have any chest pain or pressure symptoms, but instead have intense shortness of breath or epigastric discomfort that can feel like a bad heartburn. Breathlessness, nausea, vomiting, or sweat can also sometimes be associated. These symptoms are called angina. There are many treatments for angina, including medications, angioplasty and stents, and bypass surgery. Aggressive risk factor modification is part of every treatment plan. Coronary heart disease can have serious complications, including heart attacks and even sudden death. Fortunately, developing significant coronary heart disease is largely preventable. Early prevention is best, but you can still improve how you'll do, no matter how old you are, by reducing your risk factors. One study found that 50-year-old people who had not already developed significant cardiovascular disease and didn't have major risk factors reduced their lifetime risk for developing significant cardiovascular disease, and they lived longer. Continue on through this section to learn more.
Background. Patients with elevated triglyceride levels are at increased risk of ischemic events. Icosapent ethyl, a highly purified icosapentaenoic acid ethyl ester, lowers triglycerides levels, but data are needed to determine the effect of ischemic events.
At this time, about 1 out of every 3 people will ultimately die from cardiovascular diseases, which includes heart disease and stroke. Hello, I'm Erin Yukos. I'm an associate professor at Johns Hopkins, and I'm a preventive cardiologist and an epidemiologist. What this means is that I study populations of individuals to determine new risk factors that may contribute to cardiovascular diseases. I study a variety of topics, including nutrition, fitness, and blood markers of cholesterol, fats, inflammation, and vitamin D. For example, I recently found that calcium supplements, commonly taken by many adults, may contribute to plaque buildup in the heart's arteries. I'm also interested in understanding mechanisms of heart disease, specifically in women, which may be different than those in men. Identifying those at risk is the first step towards developing strategies for preventing cardiovascular disease, which is the #1 killer of men and women in the United States and in developed countries worldwide. But the good news is that cardiovascular disease is largely preventable, and death rates are declining due to advances in prevention.
Icosapent ethyl is a highly purified and stable EPA ethyl ester that has been shown to lower triglyceride levels and used as an adjunct to diet in adult patients who have triglyceride levels of at least 500 milligrams per deciliter.